the nation. You should know that. Protect your child from the killer diseases. A healthy child is a pride of a parent.
I appeal to all parents. Prevention is better than cure.
This is to inform the public that the federal government will carry out mass vaccination campaign to protect children across the country from deadly diseases. Measles rubella vaccine for children 9 months to 14 years. Childhood vaccines for children 0 to 23 months. Polio vaccine for children 0 to 59 months. HPV for girls 9 years. Plus protection from malaria and neglected tropical diseases. Phase 1 starting in October in northern states and Oyo. Phase 2 begins January to February 2026 in the southern states. After the campaign, routine vaccination continues in all health facilities. Vaccines are safe, effective, and paid for by the government. Don't wait. Visit your nearest health facility or vaccination site. Leave no child behind. This message is brought to you by the National Primary Healthcare Development Agency and partners. This na to inform the general public say federal government go carry out mass vaccination to protect we children across the country from deadly disease them. Measles and rubella vaccine for children 9 months to 14 years. Pikin vaccine for children when they 0 to 23 months. Polio vaccine for children when they 0 to 59 months. HPV for girls when they 9 years plus protection from malaria and neglected tropical disease them when they call NTD. Phase 1 go start October for northern states and Oyo. Phase 2 it go start January to February 2026 for we southern states. After the campaign, vaccination will continue for all we health facilities. Vaccination they say for it they work and we government don't pay for them. No wait. Visit the health facility or vaccination site when near you pass. Not leave any child behind. Now, National Primary Healthcare Development Agency with the partners bring on this message.
Good afternoon out there. You're welcome to Measles Rubella Vaccination Campaign Radio Show on Ekiti FM 91.5. Ado Ekiti. My name is Oluwasegun Fumi Ogbimi, and I'm glad to welcome you to this week's edition of the program. Most especially, today is Wednesday, which is the 14th day in the month of January 2026. And we are now on the 19th edition of the program. What are we going to talk about today on this program? We shall be taking a look at the significance of the stakeholders across all the local government areas of Ekiti State before, during, and after measles rubella vaccination campaign and immunization in Ekiti State. And so what are we going to be talking about? Who are the stakeholders? Maybe I should just start from there. Well, I think we have said this several times on this program, the stakeholders, who they are, and what we expect them to do concerning the measles rubella vaccination campaign radio show on Ekiti FM, and how to actually spread the good news across all the local government areas in the state. And let's quickly take a look at this. Here is the breakdown of the significant roles before the campaign. This is what we expect some of the stakeholders to do. I will start by mentioning the health educators. Well, the health educators, they have much role to play, just like the community engagement. Health educators engage with stakeholders, including traditional rulers, religious leaders, school authorities, and parent-teacher associations to endorse the vaccination exercise. Yes, this is one of the primary assignments of the health educators all over the local government areas in Ekiti State. They just have to be there to do what? Again, they have to engage stakeholders at the local government level, including traditional rulers. They have to engage them. Religious leaders, they have to engage them. School authorities, they have to engage them as well. And parents, teachers, associations members, they just have to engage them to endorse the vaccination exercise. And secondly, it's about the sensitization that they must do as well. Health educators and mobilizers should sensitize the communities about the importance of vaccination addressing myths and misconceptions. Yes, we have said this as well. Some parents, they will say, no, don't do this to my child. I don't want this. Please, this time around, you just have to allow your parent to be vaccinated when it is time to do so, because I believe the whole thing is coming on the 20th of this particular month, from 20 to 29 of January 2026. That's just the scheduled dates for the immunization exercise to actually begin in Ekiti State and all over the Federation, especially in the southern parts of the country, which is the southwest and up to the southern parts of Nigeria. And again, planning, very, very important. The health educators and mobilizers that we have around in all the local government areas of Ekiti State, they just have to start planning right now. How do they go about this? Health educators and mobilizers help to plan vaccination strategies, including identifying target areas and populations. Well, health educators, I want you to feel free to call our dedicated line today, which is the studio dedicated line. You just have to call and pass few messages to us here so that we can actually know you are listening to us, and we want to know how far you've gone concerning what we have talked about on Measles Rubella Vaccination Campaign radio show on Ekiti FM 91.5, and of course, getting in touch with the appropriate stakeholders at the local government level. We want to hear from our local health educators across all the local government areas we have in the state. Likewise, the mobilizers would like to listen to you as well. The number to call is 0813 013 2097. 0813 013 2097. Again, 0813 013 2097. We are talking about what we expect the mobilizers, health educators at the local government level, what they should do before the campaign, during the campaign, and after the campaign. And this is exactly what we're talking about today on this program, which is the 19th edition of Measles Rubella Vaccination Campaign radio show on Ekiti FM 91.5 at Do Ekiti. We've talked about three things that must happen before the campaign. Community engagement, very, very important. Sensitization, very, very important. And the last one is planning, which we talked about. Now, let's take a look at what we should do, the mobilizers and the health educators, what they should do during the campaign. 1. Mobilization. Mobilizers encourage parents and caregivers to bring their children for vaccination. So you have to mobilize, and if you have not been doing this, you just have to do this. That's the much reason why I quickly opened the port for mobilizers and health educators at all the local government areas, at the local government areas level, to talk to us on this show, to let us know how far they have gone on this. And I'm sure they have already worked very well for the implementation proper to begin in January, in this month, which is January 2026. Beside mobilization, we also have what we call vaccination support. This is another vital role that must be played by mobilizers and health educators at the local government level. Yes, what do we expect from them by saying vaccination support? Health educators support vaccination teams. Yes, they have to support vaccination teams, ensuring smooth operations at health facilities and temporary vaccination posts. This is a very vital one that we expect them to do at the local government level, at the grassroots level. They just have to support vaccination teams, ensuring smooth operations and health facilities and temporary vaccination posts. And the last one before we move on to after the campaign, this is addressing concerns. Health educators and, of course, mobilizers, they need to address concerns, and questions from parents and caregivers, providing accurate information about the vaccine. Yes, this is exactly what we expect them to do concerning during the campaign. You are listening to Measles Rubella Vaccination Campaign radio show on Ekiti FM 91.5 Ado Ekiti. And we are taking a look at what we expect the health educators and mobilizers at the local government level, what they should do before the campaign, during the campaign, and after the campaign exercise. Now we are on the after the campaign exercise, what they should do. 1. Monitoring. Health educators and mobilizers help to monitor vaccination coverage and identify areas that requires follow-up. That's exactly what they should do. Don't forget, I want you to pull your call across to us. If you have questions, please do that. We are ready to respond. The number to call is 0813-013-2097. 0813-013-2097. That's the number to call. As an health educator at local government level, please call this phone number and talk to us. Mobilizers at local government level, call this number and talk to us. We want to see how far, we want to hear from you. What are the challenges you are facing on the field and what you need to do. And we also want our parents, the caregivers out there, our religious leaders, our royal fathers to also talk to us on this particular number as well to let us know, have you been receiving health educators? Have you been listening to mobilizers at the local government level? What have they been doing? Have you ever seen them? Have you ever received one or two of the pamphlets that tells you what to do concerning the measles rubella vaccination campaign ongoing in the states? Yes, we'd like to hear from you. It's just a feedback mechanism on this channel. We want to hear from you if they're actually doing the job at the local government areas level. So right now, let's quickly take one or two messages. We'll be right back after now. Please don't go away. Stay with us.
This na to inform the general public say federal government go carry out mass vaccination to protect we children across the country from deadly disease them. Measles and rubella vaccine for children 9 months to 14 years. Pikin vaccine for children when they 0 to 23 months. Polio vaccine for children when they 0 to 59 months. HPV for girls when they 9 years plus protection from malaria and neglected tropical disease them when they call NTD. Phase 1 go start October for northern states and Oyo. Phase 2 it go start January to February 2026 for we southern states. After the campaign, vaccination will continue for all we health facilities. Vaccination they safe for it they work and we government don't pay for them. No wait. Visit the health facility or vaccination site when near you pass. Not leave any child behind. Now National Primary Healthcare Development Agency with the partners bring on this message.
You're still on to Ekiti FM 91.5 Ado Ekiti, and we are talking about measles and rubella vaccination campaign radio show, which is the subject of the matter on this show today. Fún ẹ̀yin tí ẹ bá ṣe ń darapọ̀ mọ́ wa nígbà àkọ́kọ́ lórí ètò yìí, ohun tí à ń gbéyẹ̀wò náà ni gbígba abẹ́rẹ́ àjẹsára tí a mọ̀ sí measles àti rubella fún àwọn ọmọ nígbà tí àsìkò ọ̀hún bá tó. Ogúnjọ́ oṣù yìí òun náà ni gbígba abẹ́rẹ́ ọ̀hún tó jẹ́ pé a ti ń polongo rẹ̀ fún bí oṣù bíi mélòó kan báyìí sẹ́yìn. Òun náà ni yóò bẹ̀rẹ̀. Ohun tí a ṣe gbé ètò ìkàlẹ̀ náà ni pé gẹ́gẹ́ bí àwọn elétò ìlera iṣẹ́ tí wọ́n rán mi lèmi ń jẹ́ o. Ohun tí wọ́n sì kọ fún mi lèmi ń kà fún ẹ̀yin olùgbọ́ wa. Gẹ́gẹ́ bí ẹ ti rí pé a ti gba ìpè lọ́pọ̀lọpọ̀ lórí ètò tí àwọn kan pè tó ń sẹ́ pé abẹ́rẹ́ yìí ó dára fún àwọn ọmọ tó fi mọ̀ dájú pé ẹni tó perú ìpè bẹ́ẹ̀ yẹn òun náà rí pé ó dára, òun ló ṣe fẹ́ kí aráàlú kí ó gbọ́. Gẹ́gẹ́ bí ohun tí a gbọ́, ohun tán dẹ̀ fi tó wa létí àti pé pàápàá àwọn sàràkí aráàlú tí a ti gbé wá sí orí ètò yìí tí wọ́n ti sọ, àwọn dókítà wọ́n ti wá sórí ètò yìí tí wọ́n ti sọ nípa ti ìmọ̀ àti ìrírí tán ti rí nípa ti abẹ́rẹ́ yìí. Òun náà ni wípé abẹ́rẹ́ yìí ó dára gidi gan. wọ́n ní pé ó ń dènà àrùn yíkíyíkí kódà gan ìkan tún wà tó tútù rú jáde báyìí tán pè ní rubella. Wọ́n ní ó dára kí àwọn ọmọ wa kí wọ́n gba abẹ́rẹ́ yìí. Ọmọ oṣù 9 sí ọmọ ọdún 14 náà ni ó ní àǹfààní láti lè gba abẹ́rẹ́ yìí. Kódà gan àwọn olórí ẹlẹ́sìn wọ́n ti wá sí orí ètò yìí táwọn náà ti wá bá àwọn ọmọlẹ́yìn wọn sọ̀rọ̀. Ẹ̀sìn ti kìrìsìtẹ́nì ni, ẹ̀sìn ti mùsùlùmí ni, àwọn náà ti wá. Kódà gan àwọn ìyálọ́jà àwọn kan náà ti yọjú lórí ètò yìí. Ìdí ni èyí tó jẹ́ pé àfi wá ń sọ wọ́n ti wá dádé mi nìkan báyìí o. Ohun tí a ti sọ tẹ́lẹ̀ òun náà ni mo mú wá sí ìrántí fún ẹ̀yin aráàlú lórí ètò yìí torí pé abẹ́rẹ́ oṣù náà ni yóò gbéra tí wọ́n máa gbà fún àwọn ọmọ pátápátá, àwọn ọmọ tó jẹ́ pé ọjọ́ orí wọn kọjá oṣù 9 sí ọmọ ọdún 14. Léyìí tí a wá gbé jáde lónìí ó ti ń ṣe apá ìkọkàndínlógún rẹ̀. Òun náà ni a wá fẹ́ wo ojúṣe àwọn olùlanilọ́yẹ̀ fún ti ètò ìlera láwọn ìjọba ìbílẹ̀ wa àti àwọn tó jẹ́ pé wọ́n ti ń dìídì káàkiri tó ń pe àwọn ìyá ni o, tó ń yà sáwọn ìjọ, tó ń yà sáwọn ilé ìjọsìn, tó ń yà sí àwọn ọjà, kódà gan tó tún lọ sáàfin kábíyèsí àti ibi gbogbo ibi ìpàdé ìlú tó ń fi ń tó àwọn aráàlú létí pé ẹ gbọ́mọ jáde nígbà tí ó bá tó àsìkò kẹ́ gbọ́mọ jáde. Ẹ jẹ́ kí a wá wo ojúṣe wọn àti ipa tí ó tọ́ fún wọn láti kó lórí ètò yìí. Yálà kí ìpolongo èkó tó bẹ̀rẹ̀ ni o tàbí láàrin ìpolongo àti ní ìparí ìpolongo. Gẹ́gẹ́ bí ohun tí mo ti sọ ṣáájú, mo ní ẹ lórí ọ̀fẹ́ láti pè sórí ìpè wa yìí. Nọ́mbà ìpè náà ni 0813 013 2097. Ẹ̀yin abámọ́ lè pè ohun tó bá rí yín lójú ẹ béèrè. Tí ìdáhùn bá ń bẹ lọ́dọ̀ mi bí báyìí wọ́n ó dá yín lóhùn. Àwọn elétò ìlera náà ibi tí ẹ bá ṣẹ́dé ẹ jẹ́ kí aráàlú kó mọ̀. Ẹ pè sórí nọ́mbà 0813 013 2097. Ẹ jẹ́ kí a jọ ṣe kó bá lè rí bí ó ṣe yẹ kí ó rí. Kódà gan ohun gangan tí ìjọba fẹ́ mú jáde lórí ètò yìí kí wọ́n lè rí mú jáde. Ọ̀fẹ́ ni wọ́n pe ètò yìí o, kò nídìí pé ẹ̀yin òbí ẹ̀ náwó. Ẹ jẹ́ ká wá wo ojúṣe tí à ń retí látọ̀dọ̀ àwọn elétò ìlera ní àwọn ìjọba ìbílẹ̀ wa wọ̀nyí, pàápàá jùlọ àwọn tó wà fún ìpolongo àti kíkàkiri láti jẹ́ kí àwọn aráàlú kó mọ̀ bó ṣe ń lọ nípa ti gbígba abẹ́rẹ́ àjẹsára measles àti rubella yìí. A sọ̀rọ̀ nípa community engagement. A ní àwọn olùlanilọ́yẹ̀ nípa ti ètò ìlera nídìí láti kàn sí àwọn tí ọ̀rọ̀ yìí kàn gbọ̀ngbọ̀ngbọ̀n wọn sọ̀rọ̀ sàràkí ìlú láti bá wọn sọ̀rọ̀ láti pàrọwà sí wọn, pàápàá jùlọ àwọn iléèwé wa wọ́n máa ń ní ìpàdé òbí àti olùkọ́. Àwọn elétò ìlera ìlú náà lè yọjú síbẹ̀ láti gbà wọ́n nímọ̀ràn nípa ti abẹ́rẹ́ yìí. Àwọn olórí adarí ẹ̀sìn gbogbo nígbà tí ẹ̀sìn bá ń lọ lọ́wọ́ àwọn náà lè yọjú síbẹ̀ láti gbà wọ́n nímọ̀ràn. Bákan náà ni pípolongo sensitization, pípolongo nípa ti ètò abẹ́rẹ́ àjẹsára yìí àti pé pàápàá láti fi dáwọn èèyàn lójú pé ohun tí wọ́n ń rò àti àwọn àhesọ tí wọ́n ti gbọ́ nípa abẹ́rẹ́ yìí kò rí bẹ́ẹ̀ rárá. Ojúṣe àwọn olùlanilọ́yẹ̀ láwọn ìjọba ìbílẹ̀ wa òun náà ni eléyìí. Bákan náà ni ṣíṣe àpérò àti ọ̀nà tí àwọn gbígba ìpolongo láwọn ìjọba ìbílẹ̀ àti gbígba abẹ́rẹ́ àjẹsára yóò ṣe kẹsẹ̀ járí láì kò sí wàhálà nú. Wọ́n ní ó yẹ kí wọ́n dá àwọn ibi tí àwọn ìyá ọlọ́mọ ó yẹ kán dá ibẹ̀ mọ̀. Àwọn ìyá ọlọ́mọ tó yẹ pé ọmọ wọn jẹ́ oṣù 9 sí ọmọ ọdún 14 ó yẹ kán dá ibẹ̀ mọ̀. Àti pé pàápàá ibi tí àwọn irú ọmọ báyìí tó yẹ pé ètò yìí wà fún tó bá pọ̀ sí target areas and populations ó yẹ kí wọ́n dá ibẹ̀ mọ̀. A tún wá sọ̀rọ̀ nípa ní àsìkò ìpolongo during the campaign. During the campaign a sọ̀rọ̀ nípa mobilization, kíkó àwọn èèyàn jọ láti pàrọwà sí wọn, àwọn ìyá ọlọ́mọ nípa ti abẹ́rẹ́ àjẹsára tá à ń sọ̀rọ̀ rẹ̀ yìí, àti pé pàápàá sọ̀rọ̀ nípa àwọn elétò ìlera láti kín àwọn elétò ìlera torí lábala ni àwọn elétò wọ̀nyí wà. Wọ́n ń pè ní vaccination teams, àwọn tó ń gún abẹ́rẹ́ gangan ni àwọn yẹn, láti kín wọn lẹ́yìn láti ràn wọ́n lọ́wọ́ láti rí mọ̀ dájú pé gbogbo ẹ̀ lọ ní ìrọwọ́ ìrọsẹ̀ láì kò sí kọlù ń kọ́ a sọ̀rọ̀ nípa ìyẹn náà. Bákan náà ni a tún wá sọ̀rọ̀ nípa addressing concerns, àwọn tó jẹ́ pé ọ̀rọ̀ yìí bá rú lójú wọn nìkan làwọn lọ́yẹ̀ nípa rẹ̀. Eléyìí tí mo gbẹ́nulé kó tó di pé a mú ìkéde àti ìpolówó ọjà wá, mo sọ̀rọ̀ nípa ẹyọ kan ṣoṣo kó tó di pé a kọjá lọ sí ẹ̀ka ìkéde àti ìpolówó ọjà láti mú ìkéde àti ìpolówó àwọn tó ṣòǹgbọ̀wọ́ ètò yìí wá sí etí ìgbọ̀nyín òun náà ni nípa ti monitoring ìfojúsí gbogbo bí ètò ìlera ọ̀hún bó bá ṣe ń lọ láti rí mọ̀ dájú pé ó kẹsẹ̀ járí láì kò sí wàhálà kankan àti pé pàápàá lẹ́sẹẹsẹ ni ìfojú sí àwọn ìṣètò wọ̀nyí yóò máa wáyé. Mo wá ní nọ́mbà tẹ́ máa pè sí rèé o ẹnikẹ́ni tó bá ní ìbéèrè pàápàá jùlọ ẹ̀yin elétò ìlera láwọn ẹsẹ̀ kùkú wa ẹ bá wa sọ̀rọ̀ ibi tẹ́ ẹ bá ṣẹ́dé láwọn ẹsẹ̀ kùkú wọ̀nyí. Nọ́mbà tẹ́ pè sí rèé 0813 0132097 0813 0132097 nọ́mbà tí ẹ máa pè sí nìyẹn láti bá wa sọ̀rọ̀. Ẹ̀yin tó yẹ pé a ti píwèé pélébé dọ́dọ̀ yín tán ti fi hàn yín pé bó ṣe máa rí leléyìí ẹ jọ̀ọ́ ẹ gbìyànjú láti rí mọ̀ dájú pé ìpolongo yìí ó kárí láti ọ̀dọ̀ yín náà. Ẹ má dáadáa àwọn elétò ìlera nìkan ṣoṣo. Ìkejì tó tún ní ṣe pẹ̀lú ohun tí a lè ṣe lẹ́yìn ìpolongo àwọn elétò ìlera ní ilé kan gbọ̀ngbọ̀n pàápàá jùlọ ní àwọn ẹsẹ̀ kùkú wa ìjọba ìbílẹ̀ wa gbogbo. Òun náà ni the conduct follow-up visits to ensure that children who makes vaccination are reached. Àwọn tó jẹ́ pé wọ́n ti pàdánù gbígba abẹ́rẹ́ yìí aláti rí mọ̀ dájú pé a rí wọn a sì rí dájú pé wọ́n gba abẹ́rẹ́ yìí torí a ò lè ṣaláì má rí irú ẹ̀. A ó rí àwọn kan tó yẹ pé wọ́n pàdánù abẹ́rẹ́ tí wọn ò ní oore ọ̀fẹ́ fún ìdí kan tàbí òmíì tí wọn láǹfààní láti gbà ẹ jẹ́ ká rí mọ̀ dájú pé wọ́n gba abẹ́rẹ́ yìí. Lákòótán rẹ̀ òun náà ni evaluation. Health educators participate in evaluating the campaign's effectiveness, identifying strength and weakness. Eléyìí tí ó tó ní ṣe pẹ̀lú àgbéyẹ̀wò pé gbogbo ìpolongo tó wáyé wọ̀nyẹn ṣé ó wà ní ìbámu pẹ̀lú àlàkalẹ̀ ètò ìlera àti ohun tí àfojúsùn ìjọba àti àwọn elétò ìlera lérí ọ̀rọ̀ yìí. Ibi tó bá kùdìẹ̀kudiẹ díẹ̀ sí òun náà ni àwọn náà yóò ṣe kíni wọ́n ṣe àbójútó rẹ̀. À ń retí pé kí ẹ pè wá lórí ètò yìí kí ẹ bá wa sọ̀rọ̀. À ń padà bọ̀ wá.
I appeal to all parents. Prevention is better than cure. To support immunization. Prevention is better than cure. Take your child for immunization. Prevention is better than cure. Save the young generation. Prevention is better than cure.
Parents, you are the number one shield for your children. Your child's future is in your hands. Take your child for immunization. Immunize your child for the betterment of the future and nation. You should know that. Protect your child from the killer diseases. A healthy child is a pride of a parent.
I appeal to all parents. Prevention is better than cure.
This is to inform the public that the federal government will carry out mass vaccination campaign to protect children across the country from deadly diseases. Measles rubella vaccine for children 9 months to 14 years. Childhood vaccines for children 0 to 23 months. Polio vaccine for children 0 to 59 months. HPV for girls 9 years. Plus protection from malaria and neglected tropical diseases. Phase 1 starting in October in northern states and Oyo. Phase 2 begins January to February 2026 in the southern states. After the campaign, routine vaccination continues in all health facilities. Vaccines are safe, effective and paid for by the government. Don't wait. Visit your nearest health facility or vaccination site. Leave no child behind. This message is brought to you by the National Primary Healthcare Development Agency and partners.
This na to inform the general public say federal government go carry out mass vaccination to protect we children across the country from deadly disease dem. Measles and rubella vaccine for children 9 months to 14 years. Pikin vaccine for children when they 0 to 23 months. Polio vaccine for children when they 0 to 59 months. HPV for girls when they 9 years plus protection from malaria and neglected tropical disease dem when they call NTD. Phase 1 go start October for northern states and Oyo. Phase 2 it go start January to February 2026 for we southern states. After the campaign, vaccine, vaccination will continue for all we head facilities. Vaccination dey safe, it dey work, and we government don't pay for them. No wait, visit the head facility or vaccination site when near you pass. No leave any child behind. Now, National Primary Healthcare Development Agency with the partners bring on this message.
I thank you for staying tuned. This is Mrs. Rubella Vaccination Campaign Radio Show on Ekiti FM 91.5 Ado Ekiti. Don't forget that we are still expecting your calls on the program. You can just join us and rub minds together. Talk to us what you don't know and what you want to know concerning Mrs. Rubella Vaccination Campaign in Ekiti State. Well, Mrs. Rubella Vaccination Campaign in Ekiti State aims to protect children and close existing immunity gaps. The campaign targets 17% of Ekiti State's total population with a goal of achieving 90 to 95% coverage. The vaccine will be introduced into routine immunization in the 3rd week of this month, which is next week, and preceded by a 10-day statewide vaccination campaign. Impacts of the vaccination campaign: 1. Protects children from measles and rubella, which can lead to severe complications like malnutrition, blindness, encephalitis, and death. Secondly, reduces mobility and mortality among children and mothers. Thirdly, strengthens the immune system to prevent infection and interrupt disease transmission. You now see why it is important for your child to be immunized. Yes, very, very important. Yes, you can join us in the conversation. I want to see if I can just have 1 or 2 callers here, then we wrap up the show. And don't forget that so far so good. We've talked about the best way to go about this during or before, during, and after the campaign. I want to say thank you to my studio manager this afternoon, Folusho Aduloju. I thank you for being there for me. Likewise, Sunday Ajayi, I thank you. I want to say thank you to my producer, Aditutu Olanino, and to the duty continuity announcer on this afternoon bout, that is Alex Faboro. I say thank you for being there for me, and to the executive producer of this program, talking about the general manager, Hi Chief Olu Popola. I thank you for your support on this program always. Well, to all health educators across all the local government areas in Ekiti State, we thank you for a job well done, and we look forward for you to even do more, especially that the implementation will definitely kick off next week from 20 of this month to 29th of this month. I want to say thank you once again to our listener. Don't forget, the vaccine is free, effective, and safe. My name is Oluwasegun Fumi Ogwimi saying bye for now and God bless you. Let's do this on Saturday at 2:30 in the afternoon. Bye for now.
This is to inform the public.
I appeal to all parents. Prevention is better than cure. To support immunization. Prevention is better than cure. Take your child for immunization. Prevention is better than cure. Save the young generation. Prevention is better than cure.
Parents, you are the number 1 shield for your children. Your child's future is in your hands. Take your child for
of entertainment on 91.5 FM.
We hope you've learned 1 or 2 lessons on today's edition of